Bismillahirrahmanirrahim. The quote of the day is beautiful things happen in your life when you distance yourself from all the negative things. Today the topic of presentation is World Health Organization under the supervision of Professor Dr. Saira. The learning outlines of today's presentation is international health agencies are organizations, types of international health agencies and organizations, WHO introduction, WHO objectives, WHO regional organization, WHO initiative, recent and updates and MCQs. By the end of this presentation, participants will be able to describe the international health agencies and organizations, type of international health agencies and organizations, WHO introduction, objectives, regional organization, and initiative. Now, what are international health agencies or organizations? The international health agencies are a large number of international health agencies of various sizes that provide international health assistance to improve long-term medical care in developing countries. They provide aid to victims of war, famine, and natural disasters. So the types of agencies. These may be the UN agencies that include International Labour Organization, World Health Organization, UNICEF, FAO, World Bank, UNDP, UNESCO, and UNFPA. While there may be bilateral agencies or non-governmental agencies. The bilateral agencies include United States Agency for International Development, Colombo Plan, SIDA, and DANIDA. The non-governmental organizations, uh, the largest one is the Red Cross and the other is CARE, CARE. So what bilateral and multilateral agencies? They're different. When enacting foreign policy, government face a choice between bilateralism and multilateralism. Bilateralism means coordination with another single country, for example, USA. In this, there is a coordination between two countries. The one developed country helps the other developing country. While the multilateralism is coordination among more than three countries. In this, the organization receives funds from different countries and helps the other developing countries. So the International Non-Governmental Organization. It is an organization which is independent of government involvement and extends the concept of a non-governmental organization to an international scope. The largest world international non-governmental organization is the International Red Cross and Red Crescent Movement, while the other is the Save the Children. Now the WHO. It is established in 1948 after the World War II. It is a specialized agency of United Nations and its headquarters is located in Geneva, Switzerland. Its Director General is Tedros Adhanom and its parent organization is United Nations Economic and Social Council and its website is WHO International. Apart from its headquarters in Geneva, Switzerland, it has 6 regional centers. The one is in Southeast Asia, and its headquarters is in New Delhi, India. The second regional center is in Africa, and its headquarters is in Harare, Zimbabwe. The regional headquarters is located in America. Its headquarters is in Washington, D.C., and and the region um, and the regional headquarters in Europe. Its headquarters is Copenhagen in Denmark, and the regional head center in Eastern Mediterranean region is its headquarters is Alexandria, Egypt, and the last regional headquarters is in Western Pacific region, and its headquarters is in Manila, Philippines. These are the 6 WHO regions. Now the objectives of WHO. The objective of WHO is to develop and implement multi-sectoral public policy for health, integrated gender and age-sensitive approaches that facilitate community empowerment together with the action for health promotion, self-care, and health protection throughout the life course in cooperation with the relevant national and international partners. Currently, the main objective of WHO is health for all through primary health care, the attainment by all people of the highest level of health, achievement of highest standard health which differentially on the basis of caste, region, religion, politics, and social status is the fundamental choice of each individual. The vision is the attainment by all people the highest level of health, and the mission is to lead the strategic collaborative efforts among member states and other partners to promote equity in health, to combat disease, and to improve the quality of and lengthen the lives of all the people of the world. WHO plays an essential role in improving local health systems and coordinating the global response to health threats. Their structure WHO is an organization of 194 member states. The member states elect the Director General. WHO leads the organization in achieving its global health goals. It involves Secretariat, member states, and World Health Assembly. Now, the Collaborating Center. By definition, WHO Collaborating Center is an institution designed by the Director General of WHO to form part of an organizational collaborative network set up by WHO in support of its program at the country, inter-country, regional, inter-regional, and global levels. Over 800 institutions in over 80 countries supporting WHO programs. The functions and roles of the collaborative centers are to collection, collation, and dissemination of information, standardization of terminology and nomenclature, development and application of appropriate technology, provision of reference resources and other services, participation in collaborative research, as well as promotion of application of the results of the research, training, including research training, and the last one is the coordination of activities carried out by several institutions on a given subject. Now, how WHO collaborate? The logo is working together for the good of all people and everywhere. Collaboration is the part of all that WHO do. Every day, WHO connect nations, partners, and experts so that they can go further together. Their partners help support WHO scientific work and field programs, contributing funding and resources, engage in their campaigns and programs, and join them in advocacy to bring policy and behavior change for better health. WHO work with United Nations and multilateral organizations as the only United Nations agency dedicated to global health. WHO works to harness global knowledge and resources to help member states improve health for all. It also works with government and leaders. Every part of WHO's work involves strong collaboration with governmental leaders, political will and leadership are essential agents to change to improve the health and well-being of everyone and everywhere. WHO also works with experts. WHO brings together individual experts to provide scientific, technical, and strategic advice on specific health issues. These experts act in a personal capacity and do not represent any external entity, authority, or government. WHO also works with non-state actors. WHO collaborates with non-governmental and private sector organizations, philanthropic foundations, academic institutions, and other non-state actors. More than 800 collaborating centers support WHO on issues such as nursing, occupational health, communicable disease, nutrition, and more. WHO also works with the multi-sectoral collaboration and goodwill ambassadors, innovators, and advocates. Now, the WHO transformation. Their logo our goal is clear, a modern WHO working seamlessly to make a measurable difference in people's health at country level. Their transformation goal is a modern WHO working seamlessly to make a measurable difference in people's health at country level. There are three strategic objectives and seven work streams. The objectives are fully focused and aligned for impact, enabling the full potential of their organization, leverage the global community. And their work streams include impact-focused data-driven strategy, best-in-class process, new approach to partnerships, collaborative and results-focused culture, aligned three-level operating model, predictable and sustainable financing, and motivated and fit-for-purpose workforce. So what WHO do? From 2019 to 2023, the WHO strategy is 13 general program of work that will last from 2019 to 2023 for a period of 5 years. It focuses on triple billion targets to achieve measurable impacts on people's health at the country level. The triple billion targets are to ensure by 2023 1 billion more people are benefiting from universal health coverage. 1 billion more people are better protected from health emergencies. 1 billion more people are enjoying better health and well-being. So the activities of the WHO. The first activity is prevention and control of specific disease. Immunization against common disease of childhood is priority program of the WHO. Global eradication of smallpox is an outstanding example of international health cooperation. Epidemiology surveillance of communicable disease. It also has paid attention in its program of work to non-communicable disease like cancer, cardiovascular disease, genetic disease, mental disorder, drug addiction, and dental disease. Second one is the development of comprehensive health services that promotes and supports the national health policy development and the development of comprehensive national health program. Appropriate technology for health is another new program launched by the WHO to encourage the self-sufficiency in solving health problems. Third one is family health. Family health is the one of the major program activities of the WHO since 1970. It is broadly subdivided into maternal and child health care, women reproduction, nutrition, and health education. And its chief concern is the improvement of the quality of life of the family as a unit. And the environmental health. It advises government on national programs for the provision of basic sanitary services, protection of the quality of air, water and food health condition, over radiation protection and early identification of new hazards. WHO carries out various research studies and also motivates information, act as a world library issuing health literature and information. WHO aims for the development of primary health center for the whole population, promotes maternal and child health care, promotes international standard of food, biological and pharmaceutical products. Know the initiatives that are led by the WHO. In their website, WHO has given their initiatives that is arranged in an alphabetical order from A to Z. One of its initiative is WHO 1+1 initiative, and their logo is Global Your Movement to End TB, that units 1+1 is equal to millions. In 2019, WHO launched a new initiative called 1+1 on occasion of World Tuberculosis Day. The initiative aims at advancing engagement with young people and amplifying their voices to end TB. Youth can have a multiplier effect in the fight to end TB to accelerate progress towards reaching the ambitious 2022 targets of the UN high-level meeting on ending TB, as well as the larger goal of ending TB by 2030. The 1+1 initiative relies on small actions that young people can excel at. Utilizing the untapped resource of youth, we can benefit from a social multiplier effect. If each one research, if everyone reaches one, we can reach the millions we need to end the epidemic. The goals of 1+1 initiative is mobilizing and empowering young people in the fight to end TB and harnessing their multiplier effect through the 1+1 campaign. Recognizing the contribution and participation of young people as important stakeholders in fight to end TB and respecting the diversity of young people and enabling them across the spectrum. Little actions become the big impact. The 1+1 initiative relies on small actions that young people can excel at, utilizing the untapped resource of youth. We can benefit from a social multiplier effect. If each one reaches one, we can reach the millions we need to end this epidemic. The other initiative is the safer initiative, that is a world free from alcohol related harm. Every 10 seconds, a person dies from alcohol related causes. WHO, in collaboration with international partners, launched the Safer initiative in 2018. SAFER is an acronym for the five most cost-effective interventions to reduce alcohol-related harm. No SAFER. S stands for Strengthens Restriction on Alcohol Availability. A denotes for Advanced and Informed Drinking Driving Countermeasures. F denotes for Safer facilitate access to screening, brief intervention and treatment, and E denotes for enforced bans or comprehensive restrictions on alcohol, advertising, sponsorship, and promotion, and R denotes for raise prices on alcohol through excise taxes and pricing policies. The other initiative is the Mekong Malaria Elimination Program. The Mekong Malaria Elimination Program is an initiative which supports malaria elimination across 6 countries of the Greater Mekong sub-region. That includes Cambodia, China, the Lao People's Democratic Republic, Myanmar, Thailand, and Vietnam. The Mekong Malaria Elimination was established in 2017 as a reaction to the emergency response to artemisinin resistance. A high-level plan of attack launched in 2013 to contain the spread of drug-resistant parasites and provide life-saving interventions for all Greater Mekong sub-region at the risk of malaria. The Mekong malaria elimination leads coordination among all countries in line with the strategy for malaria elimination in the Greater Mekong sub-region 2015-2030, which calls for the elimination of all species of human malaria across the Greater Mekong sub-region. Mekong malaria elimination key area of work include partnership coordination, advocacy, and communication, as well as leading teaching support on cross-country projects, regional country surveillance, national malaria elimination and intensification plans, and aggressive approaches. The other initiative is the Access to COVID-19 Tool Accelerator. Since April 2020, the Access to COVID-19 Tools Accelerator partnership signed by WHO and partners has supported the fastest, most coordinated, and successful global effort in history to develop tools to fight a disease. With significant advances in research and development by academia, provide sector and government initiatives, the access to COVID-19 tools facility is on the cusp of securing a way to end the acute phase of pandemic by developing the test, treatment, and vaccines the world needs. The major achievements of WHO includes smallpox eradication, Alma-Ata Conference, and they give the concept of primary health care, global strategy for health for all by 2020, Millennium Development Goals, and the Sustainable Development Goals. Conclusion. Although WHO has both opportunities and challenges, its contribution is great to increase the quality of life and living standards globally. In the time for the recent updates, Pakistan crisis. WHO is responding as Pakistan is affected by massive monsoon rainfall and unprecedented levels of flooding and landslides. Damage to health infrastructure, shortage of health workers, and limited health supplies are disrupting the health services. Significant public health threats include the spread of water and vector-borne diseases with outbreaks of diarrheal diseases, skin infections, respiratory tract infections, malaria, dengue, injuries, and more. With health services reduced, the management of non-communicable diseases are also affected. WHO is delivering supplies needed by health facilities and increasing disease monitoring to prevent the spread of infectious diseases. Now, these are the facts and figures given by WHO by the flood impact on health. According to WHO, there are 1,735 deaths reported, 12,867 injuries are reported, and 33 million people got affected. 84 calamity hit district and 2 million houses damaged or destroyed. 2,000 health facilities are damaged, and 8 million people need urgent essential health care. And over 10 million crops and stocks impacting health and nutrition conditions. Ongoing health threats include malaria, diarrheal disease, measles, dengue fever, and severe acute malnutrition. WHO response. WHO released $10 million US from the WHO contingency fund for emergencies, in which 1.5 million US worth of essential medicines and medical supplies provided, and 10 emergency operation centers are established, and 3 operational hubs were established. WHO supports 26 nutrition stabilization centers across the country, and WHO and Ministry of Health is strengthening the surveillance system and establishing emergency disease surveillance system. The priorities of WHO health response includes a coordination delivery of essential healthcare services, efficient management of severe acute malnutrition, and stronger outbreak detection and control. Now the time for MCQs. First MCQ is an ABC country has high child mortality due to intermittent diarrhea outbreak and severe lack of healthy workforce. During the most recent healthy meeting, the ABC country Ministry of Health determined that the government should seek support from the organizations that support long-term medical care in the country. Which agency or organization will provide the best long-term medical care in this country, whether it is international health agencies, National Diarrhea Control Organization, National AIDS Control Organization, National Institute for Population Sciences, National Institute of Health and Family Welfare Services. Which will be the agency that will support? Yes, international health agencies will be the correct option. Second MCQ is An XYZ developing country has high maternal mortality due to poor antenatal and postnatal care and severe lack of community health officers and maternal and child health officer workforce for the last 5 years in rural areas. The Ministry of Health of XYZ country allowed a single governmental organization for a developed country to deliver community case management with community health volunteers in rural areas to increase coverage of reproductive health services. This type of agency or organization involved in this scenario is bilateral agency, international non-governmental organization, multilateral government organization, multilateral non-governmental organization, or unilateral agency.
A.
Charlie.
It is a bilateral agency alpha.
A.
As a one developed country, a developed country. One developed country is helping the other developing country. So it is a bilateral agency. Third MCQ is in an ABC developing country, there are a lot of emerging pandemic threats, family planning, HIV and AIDS, health system strengthening, malaria, maternal and child health, neglected tropical disease, nutrition and tuberculosis. A government agency from ABC developed country provides funds and assistance to ABC country, which is the organization that provides funds to the ABC developing country, whether it is Food and Agriculture Organization, International Child's Emergency and UNICEF, United States Agency for International Development, USAID, or World Health Organization.
E.
Alpha.
It is USAID, United States Agency for International Development. As a developed country is helping the other developing country, and it is a type of bilateral agency. Fourth MCQ is WHO is the United Nations principal international health organization with headquarters in Geneva. It is technically an international organization, intergovernmental organization connected to United Nations. The first health organization was founded in which year? Whether in 1942, 43, 44, 46, or 48?
48.
Yes, WHO is since 1948. WHO regional divisions were established between 1949 and 1952 and were based on Article 44 of the WHO Constitution, which allows the WHO to form a single regional organization to serve the specific needs of each designated area. WHO Southeast Asia region office is based in Brazil, Republic of Congo, Cairo, Egypt, Copenhagen, Denmark, New Delhi, India, Washington, D.C., United States.
D.
Yes, Delta. The Southeast Asia regional office is based in uh, New Delhi, India. Sixth MCQ is an ABC developing country has infectious diseases, particularly HIV, AIDS, malaria, and tuberculosis. Various international health agencies, particularly WHO, provide funding and technical support. The main objective of WHO is the attainment by all the people of the highest possible level of health, mainly through primary healthcare, quaternary healthcare, restorative healthcare, secondary healthcare, or tertiary healthcare.
Primary healthcare.
Yes, primary
Alpha.
healthcare. Seventh MCQ is a new modern WHO approach has been operating in XYZ developing country due to many non-communicable diseases. WHO's new work includes the work stream focused on establishing and operationalizing an impact-focused, data-driven strategy and a new result-focused collaborative culture. The new approach applied in the country is behavioral approach, psychological approach, situational or contingency approach, transformational approach, or translational approach.
C.
D. Transformational approach.
Delta.
Yes, Delta is the correct option. Eighth MCQ is an XYZ developing country has had an increased prevalence of tuberculosis among youth for the last 10 years. The National Tuberculosis Program, in conjunction with the WHO, developed the National Youth Movement Against Tuberculosis, which aims to reach out to young people and educate all primary school students on TB knowledge and best practices for preventing TB and lung disease. The initiative of WHO to end global tuberculosis among youth is whether WHO 1 plus 0 initiative, 1 plus 1 initiative, 1 plus 2 initiative, 2 plus 0 initiative, or 2 plus 2 initiative.
Mm,
Delta.
It's Bravo.
B.
Uh, yes, B. 1 plus 1 initiative, in which if one person teaches the other one, the millions of the people will be educated. Ninth MCQ is Research conducted in ABC country showed that 74% of violence cases were alcohol positive, 54% traffic collisions, and 30% trauma from other accidents. In coalition with other international organizations, WHO launched a new initiative that can help the government reduce the harmful use of alcohol and related health, social and economic consequences. The initiative is known as GAVI Empower Initiative, Safer Initiative, Watch Strategy, or WHO 1+1 Initiative.
C.
Yes, see, it's the safer initiative that will help to reduce the alcohol-related harms. Last MCQ is WHO is a United Nations specialized organization controlling international public health. The 13th Gender Program of Work of the World Health Organization is a new instrument built to measure and enhance WHO's impact on health at national level. These aims closely related to sustainable development goals in terms of measurement. The initiative is known as Empower, Safer Initiative, Triple Billion Targets, War Strategy, RWH 1+1 Initiative.
Let's see.
Charlie.
Yes, see the Triple Billion Target Initiative. Here is the key of the MCQs, and this is our YouTube channel. All the presentations of the post-MCQ studies are uploaded here, and thank you very much.
Thank you very much, Dr. West. A very nice presentation, and you have given us a very deep insight into how WHO work, what are the role that has been assigned by WHO to these sister organizations. And yes, you have also put one of the MCQ that on C1 level, when it is founded in 1948, we all know that the global health and safety, especially during COVID-19, and how it has played its significant role in connecting the nations, partners, communities, and how it has been given a pivotal role in promotion of health and to serve the vulnerable. The most important points that you have covered is that the universal health coverage, you have talked beautifully about it, and the primary health care and how to protect the billion of people from health emergencies, especially from public health emergencies. You have given a very good insight about the well-being and the better health that has been done by WHO over the years through different programs, including the programs for the youth, adolescents, 1+1, and other programs that are related with food safety and nutrition. So all these things are beautifully explained. Very well done, Dr. Awais. I think your voice was perhaps you are suffering from flu or sore throat, but despite of this, you have given us a very good insight. And I'm very glad that the students have participated very well in the MCQ section, especially Dr. Sadia. I'm so glad that you have given most of the correct answers, followed by the other students. Very well
Thank you.
done. Please keep all this enthusiasm alive and keep up the good work. Allah
Thank you,
Hafiz.
Sudeep.
Okay,
Allah
thank you
Hafiz.
very much. Allah Hafiz.